You're working on your own vaccine, is that right? How's that going?
That's right. We're trying to accelerate a low-cost global health vaccine for COVID-19 that uses a traditional technology, the same one used for the recombinant hepatitis B vaccine, used all over the world. And what's nice about it is that technology is made locally in places like India and Brazil and Bangladesh and Indonesia. And we're partnering with an organization known as PATH that led the development of the malaria vaccine for Africa, the meningococcal vaccine for Africa. So we're excited about really making this widely available for people all over the world. We develop low-cost global health vaccines.
So you think this is something that U.S. adults could end up taking, or this is more of a unique application?
No, I think potentially it could definitely has a U.S. indication. And the nice thing about it, it's a traditional technology that induces high levels of what's called viral neutralizing antibody. And that seems to be one of the better correlates of protection. We saw that with our decade of work on coronavirus vaccines. The Harvard group confirmed that with COVID-19. So really, some of the best vaccines are going to be those that induce the highest levels of virus neutralizing antibody. And historically, those are the traditional technologies.
Interesting. Let's talk a little bit about what's going on in Texas with COVID right now. Texas Children's is now admitting adult patients. Is that right? And what's hospital capacity in general like, as far as you can tell right now?
Well, I think we still have room to go in hospital capacity, but that's not the point. The point is we're seeing this very steep rise in community transmission across the metro areas of Texas, especially Houston, this very steep and scary rise. And some of the predictive models suggest that this is going to double or triple even from what we're currently seeing. I don't know if you remember that Tony Fauci yesterday said that we've got that we could hit 100,000 cases a day in the United States. When you extrapolate times the population of Texas, we're almost there. We had 7,000 cases yesterday. So Dr. Fauci's apocalyptic predictions may already be coming true in Texas. And I think that's true in Arizona and Florida. So we're going to have to make some really tough decisions and very soon.
You know, it's interesting because we had the head of one of the major Houston hospitals on last week who was frankly unconcerned about hospital capacity, said that, he's very calm about the whole situation, said there was plenty they could do to use both existing hospital capacity and add some. The heads of all the major Houston hospitals have been pretty calm in this regard. I think they even stopped reporting hospitalization ICU capacity numbers. You're in Waco, not in Houston, but it's just interesting to me that you sound far more alarmed than they do.
Actually, I'm in Houston. So Baylor College of Medicine is separate from Baylor University. We're in Houston.
Got it.
And I am concerned, but we have a lot of room. That the Texas Medical Center's got a lot of heft. It's the world's largest medical center. It's a medical city of 60 institutions, 100,000 employees. We do have room to accommodate patients, but the issue is this. If those predictive models are correct, there's no hospital system in the world that has that capacity. And so that's where I think a lot of the emphasis has to be on right now. How do we interrupt that steep acceleration that we're seeing? And the other piece to this is I think it's disproportionately affecting low-income neighborhoods. Particularly, we don't have all those demographics yet, but I think this virus across the metro areas of the southern part of the United States is really hammering at the low-income neighborhoods, African-American, Hispanic, Latinx populations, and I'm very worried about these groups.
Dr. Hotez, it's clear that we don't have control of the virus in many parts of the country, let alone have it on the run. There was an article in today's Wall Street Journal written by Dr. Robert Gallo and our friend Dan Arbus, positing the idea that there may be existing vaccines, specifically a vaccine for polio, that may boost individuals' immune system as a kind of stopgap measure before we get a coronavirus-specific vaccine. Have you heard about that kind of research, and do you think it could be promising?
Yeah, it potentially could. I think we've also looked at not only polio vaccine, but also another live virus vaccine, the measles, mumps, rubella vaccine that may stimulates nonspecific viral immunity. That may have a role. It requires clinical trials, but that's going to take time as well to do. And one of the things I'm really very excited about coming online in the next few weeks, I hope, are some of the monoclonal antibody therapies coming out of Regeneron and Lilly, Abcelera, because they basically work on the same principle as our vaccines, neutralizing the spike protein. Those monoclonal antibodies can be used as short-term treatments or even short-term prophylaxis, which is a more elegant version from the convalescent plasma therapy being used now. You know, one of the things that's happening that we are getting patients out of ICUs faster due to a combination of the convalescent plasma together with steroids, dexamethasone, together with the anticoagulant therapy and the remdesivir. So we are doing better at ICU care, and we're learning how to take care of these patients. One of the things, though, I am worried about, even if the mortality rate goes down because of those, we're starting now to hear about permanent injury to the lungs, to the cardiovascular system, the heart, the vascular system, permanent neurologic injury because of this virus. So we still have to address that long-term debilitating effects. So the effects of this virus are going to haunt us for a generation, I'm afraid.